Hello and welcome to the Brittle Bones Society's series of podcasts. My name is Patricia Osborne. I'm Chief Exec of our UK charity, and today we'll be discussing the importance of research in osteogenesis imperfecta. In this interview we will talk about the work of the James Lind Alliance and get an update on interesting trials that are underway, including Topaz and Asteroid. We'll also find out the latest on the Rudi study. We have with us today Dr. Kassim Javid, Associate Professor of Metabolic Bone Disease at the University of Oxford. Dr. Javid is also a consultant in metabolic medicine at Oxford University Hospitals, and his research areas are in epidemiology and adult metabolic bone disease, focusing on vitamin D, osteoporosis, secondary fracture prevention, and rare bone diseases such as osteogenesis imperfecta. We have him as Chairman of the Brittle Bones Society Medical Advisory Board. Dr. Javid is Principal Investigator for the Rudi study, an NIHR-funded study of rare disease that aims to transform clinical care for participants through patient-driven research. We also have with us today friend, supporter and member of the Brittle Bones Society, Jane Eddington, who will join with us in conversation. So Jane, if you'd like to tell us a little bit about your involvement with the Brittle Bones Society charity.
Hi Patricia. My name's Jane. I've been a member of the Brittle Bones Society for as long as I can remember. I was diagnosed with OI when I was about two and a half. And I've had lots of involvement over the years, lots of visits to the conferences and support from the society for myself and my family. I've got a 10-year-old son with OI as well, so he really enjoys the support we get from the Brittle Bones Society as well. And still suffering from all the effects of OI, type 1, so it varies here and there for me, as it does for my son. But very happy that we're members of the Brittle Bones Society. They've given us a lot of support over the years.
So I think we'll get things moving, and I would like to pose a question, if I may. And I think I'll probably direct this first off to Dr. Javid, but obviously, Jane, if you want to come in and give some comment, that would be fantastic. So first off, I would say, what do we think is currently lacking in the care of people with OI?
Thank you, Patricia. I'm really grateful for the opportunity to share our thoughts on the sort of key areas that are lacking for OI. We've actually just completed a joint project with doctors, nurses, allied health professionals and patients with osteogenesis imperfecta, as well as other rare diseases in adulthood affecting the skeleton, through something called the James Lind Alliance. And what really came through that were a couple of key themes. One was there's a real lack of evidence for what really works in terms of good tests for monitoring patients as they grow older throughout their lives, and also good treatments to not only reduce pain and fractures, but other aspects of their health, such as mental well-being and their ability to work. And we've now got what we call our top 10 list of actually 11 priorities that you can find on the James Lind Alliance website. But Jane, how's it been for you when you've met with doctors in terms of the certainty they've had, in terms of the advice they've given you, the consistency of that advice? Because you've obviously been a person with OI for many years now, and you've seen things change over time.
I would say, as a patient, really going into hospitals, when you go into A&E, there's a really evident gap in the knowledge of the medical staff that you see. So the more that's known about OI, the better, really. Certainly going into any A&E department, you either get someone who's heard of it, someone who's never heard of it. Sometimes the treatment is a little bit brutal and maybe some sensitivity needs to be deployed in some cases. Certainly with a child now having it, it's interesting to see the difference between when I was growing up and now my son's health and the way he's dealt with. Certainly there is more awareness, but also it's very interesting to see what treatments are now available and that things are moving on, which is good news.
So based on that comment you've made about treatments, we're very lucky in that there are a number of new drugs that are being tested for OI, and they're being tested in what we call randomized trials, where a person comes into the study and can either get treatment A or treatment B, And it's only by doing those sort of studies that we can be very confident that the treatment actually benefits people. And many of the treatments we now use in adults, we're questioning how effective they really are. So the two studies that are ongoing, the first one is the TOPAZ study that Professor Ralston's running through Edinburgh. And this is a study that's still looking for adults with OI to be recruited into. And if you want more information, you can find this on the Brittle Bone Society website. If you click on research and studies and get involved, you'll see the TOPAZ study. And they've got over 20 sites now across the UK and the Republic of Ireland where you can join the study. And I think they've recruited over 80 people so far. So it's going really well. And they are looking for more people with OI to join, because this is part of what we're finding is that we have to work with people with OI to get the evidence we need to take to everyone, from politicians, healthcare managers, as well as doctors in A&E and in specialist centres, to improve the care we provide. The other study that's no longer looking for new patients to join is the ASTEROID study, and this is using a different drug. And we're keenly awaiting to see what the results of this study will show, to see if monthly infusions of a new drug for bone health work in people with OI to reduce the fragility of the bones and then reduce fractures. One area that we have been working on is trying to actually describe what it's like for a person living with OI in terms of the impact on their quality of life and also pain, sleep, and other dimensions and aspects. This information is really important for researchers so they know what sort of areas of a person's life they need to look for developing new tests and treatments, but importantly also to figure out how they know if a treatment or test is working well enough to take forward to the next stage. And as Patricia mentioned earlier, I'm leading a study called the RUDY study. It's actually a study that's co-developed with people with rare diseases to help them not only help researchers, but also help themselves by taking part. Now, Jane, you're a member of RUDY. Can you just describe why you got involved and what you found since you've joined the study?
Well, I was put in touch with the RUDY study by you, actually, as my consultant. And I was quite interested to take part in some research anyway. It's interesting just to see the progression of how OI is treated. And I found it a really fascinating thing to do, actually. It's really interesting to be able to see how you can record your fractures on there and see a timeline of your life and how things have affected you. We tend to just deal with things as they come along, but actually looking back, there are sort of little patterns in events that take place, and it's interesting to log your different treatments that you've had over the years, because best will in the world, we tend to forget what we've had and when. There's also ways to see how your input has been used in different research programs and papers that have been produced. So that's a good way to look back and see that you're actually making a positive impact. It's been quite fun, actually. I'm on the patient forum for RUDY as well, so you get to see a little bit about how it develops and how it's all put together, and seeing it from a patient's perspective, so making sure it fits us as well as it does the professionals on the other side.
Thanks for that, Jane. I think that's a really important point you've made. We were really keen, and we thought it was very important that people with rare bone diseases often have a lot of demands on their time, and we wanted to make sure that any time and effort they spent in taking part in the study, they'd actually get something out of it themselves, either immediately by having their own personal record of how OI has affected themselves, but also seeing how their data has been used to inform research. So we're working with researchers across the country now, and it is a study across England, Scotland, Wales, Northern Ireland, to look at how mobility and function of people with OI differs by their type of OI, and also trying to understand within each group of people with OI, what are the real drivers for how well people are going to function over time. Because it's for us, one of the key challenges is actually someone coming with a diagnosis. We know which gene it is, we know there are other sort of lifestyle and baseline factors, and then being able to say, look, in 5, 20, 30 years, this is what we would kind of expect would happen. Not only in terms of fracture, but in terms of pain, mobility, ability to work. And these are the key areas which to date we have very little information to guide people other than it's a very variable disease. We never quite know how it's going to pan out. Some people don't get affected very much and some people do. I think we now have the science to be a lot better at answering these questions, which I think people are really keen to find the answers to.
Thank you so much, Dr. Javid, and thank you, Jane. That was a really interesting and fascinating insight into the question that we posed about what's currently lacking in the care of people with OI, and to get that glimpse of the trials that are ongoing and the benefits they hold. You can, as Dr. Javid mentioned, find out more about these studies on our website at brittlebone.org, where you can also see updates about all the fascinating research affecting people with OI. We look forward to sharing further updates with you, our listeners, all about OI research and a number of different topics in the future. Thanks for listening.